Welcome back. Heart disease remains the leading cause of death in the United States, and now experts are analyzing another risk factor, financial stress. Worrying about money and food may age the heart even faster than traditional risk factors of cardiovascular disease. That's according to a new study published in the journal Mayo Clinic Proceedings. Ivan Rodriguez shows us the latest on the study and what steps people can take to improve their heart health.
These latest findings are raising new questions about how financial stress fits into cardiovascular health. A doctor I spoke with tells me this study shows health is not only shaped by the care people receive, but also by certain conditions in their lives. Researchers analyzed data from over 280,000 adults who sought treatment at the Mayo Clinic between 2018 and 2023. These patients completed surveys about their social and economic factors in their lives and underwent evaluations of their cardiovascular health. Instead of only looking at whether people developed heart disease, researchers focused on their cardiovascular age, which is how old a person's heart and blood vessels look compared to what one would expect given their actual age.
People who reported higher levels of financial stress had more advanced cardiovascular age.
Dr. Lena Wen was not a part of the research, but says the study shows financial stress tended to increase heart aging at a rate that was similar or greater than other risk factors like high blood pressure and diabetes.
We also have to think about the issue of compounded risk factors, which is that somebody could have high blood pressure and they also have financial stress. That person now has two significant risk factors for worse cardiovascular health.
Certified financial therapist Rick Kaler says people with financial stress need to separate the numbers from the emotions.
We need to slow down the nervous system. Trying to solve a money problem when I'm flooded and I'm in fear and panic often backfires.
Once those feelings have subsided, Kaler says work on one small financial action at a time.
Just making a call, researching one thing, rather than feeling you've got to tackle the whole problem.
Dr. Wen also says just because someone has financial stress doesn't mean that they're doomed to poor health. There are meaningful steps people can take, like regular physical activity, a balanced diet, and maintaining a healthy weight, to name a few. Also, routine checkups matter because many cardiovascular risk factors develop silently. In Atlanta, I'm Ivan Rodriguez.